Rahmatullah. This is Mohamed Hany, the Professor of Family Medicine in the College of Medicine and Medical Sciences at the Arabian Gulf University in Bahrain. Today we resume our series about OSCE, and this is the OSCE case writing presentation. To brief the last session, we agreed that the OSCE is a highly reliable assessment tool, and it can be conducted using several approaches. And the most important thing is OSCE is an assessment of clinical skills. One more tip. Please note that all the assessment tools triangulate with each other to give you a better understanding of the level of competency of your students, of your candidates. So each one looks at a certain to the candidate from a certain angle. There is no perfect assessment tool. MCQs are not perfect. OSCE is not perfect. Workplace-based assessment alone is not perfect, but together they improve their validity and their reliability. So you better use a mix of assessment tools. The next thing is OSCE is an assessment of clinical skills. Please, if you have some learning outcomes that you need to assess, consider other tools or consider the most appropriate one. For example, if you are assessing the ability of the candidate to use his knowledge to know what is the second line treatment when the first line treatment fails, this is an excellent example of an multiple choice question, a single best answer question, or which treatment to use for which comorbidity. This is an excellent multiple choice question. If you want to examine how the student can, for example, insert nasogastric tube or conduct CPR, this is better to be tested in the workplace using the workplace-based assessment tools. But if you want to examine an integrated body of clinical skills, if you want to examine how to assess the cardiovascular risk factor in a patient, and to assess the risk, the level of compliance or adherence of this patient, and to use communication skills to convince him about the right treatment that the candidate will choose, please use OSCE. OSCE is valuable. It consumes resources. Please keep using OSCE to the most appropriate learning outcomes and not for outcomes that can be covered by other assessment methods. The last slide of our last presentation was about improving the validity and reliability of OSCE through proper case writing, role players training, and assessor training. Today we are covering the case writing. Why is case writing so important? Why is it important to use specific templates for case writing? Because there is a whole communication process that sets the validity of the case. By this, I mean that you had an initial idea while you start thinking about writing this case, and what the candidates perceive is a totally different thing, because it went from your brain into the written case, into someone else reading it, and another one performing it, and another one perceiving it. So from taking the case from the learning objective to a written case, to some team to review the case and improve the content of the case, to assessors who are maybe not from the team, they read it for the first time on the day of examination, to role players in different floors who are expected to understand what you've intended from the start and act and react to the candidate's performance based on this, and to the candidates who might perceive a totally different thing. So only if you use good practices in writing OSCE cases, you will be able to decrease or lessen the level of threat to the validity of your case through all these steps of OSCE case. So how to start? Decide what tasks you want to examine using OSCE, what are the tasks that you can examine using OSCE, and what are the tasks that should be tested using OSCE. We might start with a real case from the real life and align it to our learning outcomes. Or we have a previously written case and we kind of, you being smart, cloning this case into a different context where it covers wider areas of our blueprint. By this, I mean, for example, if we had a case about a controlled case of hypertension that we might, the focus of the case might be about giving healthy lifestyle advice. We can change it to uncontrolled one. We can change it to uncontrolled case with poor compliance. We can change this into a patient with a higher cardiovascular risk assessment. We can change it to a case of a hypertensive patient with asthma or hypertensive patient with diabetes. So you might multiply your case and clone the case into multiple cases where you can really cover wider areas of your blueprint. So these are the contents of an OSCE template or an OSCE item template. No one will disagree with this, but I will give you the usual and some tips or some things that, if added, will add value to your OSCE items. The main things are examiner instructions, candidate instructions, marking scheme, simulated patient instructions, and equipments and props needed for the case. We will start one by one and see what to write inside it and why do we do this. The first thing is the assessor instructions. You provide a summary about the case and a summary about what's expected from the candidates to do, and you also put your learning outcomes. It's not here, but this is for the sake of the presentation. This is the short version of the provided case. So this case is about a 27-year-old taxi driver who's presenting with simple muscular low back pain, and he is demanding for a sick leave and an X-ray for his case, for his back. And you are instructing also the assessor, the candidates are not supposed to do any clinical examination. If the candidate asks the patient to come for clinical examination, please provide him with the examination finding. So this will actually help to standardize the assessor performance and standardize their understanding of the case, and when they are expected to intervene and when they are expected to observe. This is this one we usually use in our case templates, but this one is an addition. You might need to add the focus of the station. So for example, this station will include history taking, clinical examination, differential diagnosis, and management. This same case of low back pain. But my focus as a writer was on testing the ability of the candidates to use communication skills effectively to address the ideas, beliefs, concerns of the patient. So this focus of the station will help convey your idea to the assessor and avoid unwanted noise that might threat your validity, the validity of the case. Another very good thing to start with is to mention what is expected from good candidates, what the candidate need to do to pass the station. So in agreement with the focus of the station, a good candidate should refuse prescribing or requesting an X-ray and giving a sick leave to the patient with proper explanation about why am I refusing this. This is something that really improves the standardization and the outcomes of the assessors. And it will help the assessor also implicitly think about what should not be tested in this station. And please, while writing this, think about the level of experience of the candidates that you are testing. After finishing the examiner instructions, we go to the candidate instructions. We are all familiar with this. We will have two copies of this one, a copy in the case file and another copy displayed in a place where the candidates can read before going into the cubicle or into the examination. So you are describing as a candidate who you are, where are you working, what's the setting, and who is your patient. You might provide some information about the patient illness. You might put also reports about like imaging reports or lab results, but please be very brief, because in the exam conditions, the candidates will not be 100% able to focus and interpret this. So please provide this information. Whatever is written here, you train your candidates. Whatever is written here, please do not ask about it again inside the station. Then we move to the equipment needed. Please think with your team about what's needed in this station. For example, here we provide prescription forms, radiology request forms, the sick leave form, and a pen for the candidates to use. And for the assessors, we deliver the examination findings. It's important here to consider this and consider helping your colleagues who are preparing the OSCE sitting and on the OSCE days to get everything perfectly prepared. If you are going to ask your candidates to bring their tools, please be clear about what tools you expect them to bring. This is essential for organization, as we've said. It also might include, a good tip is to include the role player characteristics. So if you have some kind of inventory of your trained role players, you better add here the age, the gender, maybe the weight, the socioeconomic impression about the role players. So people who are responsible to recruit role players for the exam day will be helpful to you, and by this you avoid unnecessary surprises on the day of the OSCE exam. Next thing, and most important thing, the role player. This is the core of the template. So, and this is very important, the opening statement. My back hurts me badly, doctor. This opening statement need be short enough for all role players in all rotas, mirror stations, all the floors to repeat. It puts your candidate on the right track from the start. You might also add how to deliver it for the role players. Deliver this in an anxious manner and hold your back, for example. You might also add this to them. It will help their performance. Then, after the opening statement, we put information to give voluntarily. This information is the response of the role player to the open-ended question of the candidate that follows the opening statement. So, please tell me more about your back pain. He will say, it was for 6 days, it's for 6 days now, it radiates to this place, and it's relieved by this, aggravated by this. I also have a cousin who had a similar back pain and was operated on. So these also help your candidates to communicate properly, because we teach them to use open-ended questions and to be on track, and it will help your role player to have something to say in response to this question, and to standardize the performance of all the role players across the different routes. After this, we add specific instructions to the role player. Please do not reveal this information unless you are asked for. Again, this is a short version of the actual case. So for the role player now, he will say that I smoke, I have a sad mood, but I have a normal social activities. I have some marital conflicts. I'm not satisfied with my job. These are important things for the candidate to ask about. And the assessor, remember, the assessor is observing this. By constructing the role player instructions in this way, you are actually helping to not only to standardize the performance of role players, but also to standardize the judgment of your assessor. Then specific use by the end of the consultation. If you are asked about your expectation, you expect the doctor to request X-ray and to write a sick leave for you. So now we are focusing on the ILOs. What should be tested What are the candidates are tested for in this station? Last part of the role player instruction, past history, need to be short or according to the case. And the other two are very important. Questions for the role player to ask. So if the candidates did not cover these points, please, by the end of the consultation, ask him about how this will affect your job. Is it similar to my cousin's condition and I will need to be to have a surgery? These are very important because they help the candidates get back on track from one point of view. From the other point of view, they help the assessors also observe what's missing in this case. But the role players need to be properly trained not to jump into these questions earlier in the consultation. Only ask these questions if the candidates are silent and they are really have nothing more to ask the role player about. Another very important thing, what is their behavior, the expected behavior, the body language of the role player? What are the words to use during the consultation? For example, here we are asking the role player to use words like, I'm worried, I'm concerned. We want him to be sitting in a certain way on the chair. We will tell him when to express relief, when to accept the doctor's explanation about the unnecessity of X-ray at this stage of the illness. So this will help your role players in the different floors or in the mirror stations to react properly to different expected candidates' actions. At last, we come to the marking scheme. This one is constructed from 3 items: communication skills, history taking, and management planning. And at last, in the last part, we have overall judgment. We will talk in more details. I will elaborate about this in the next presentation. We don't have marks here. We have only like check boxes where the assessors just observe and see, is the candidate really conduct analysis of pain? I will choose from clear pass to clear fail. We will come to this again, but this needs to be specific. So again, it will provide a continuum with the ILOs, with your provisional idea, with the focus of the station, and with the role player scenario. It needs to be consistent to all of these. And it describes what a competent candidate do again. And please do not use abbreviations. We will come back to this in the next presentation. So what makes for an ineffective case? An ineffective case is written by a very ambitious writer who expects a perfect candidate who can perform perfectly in every domain. This will be, unfortunately, an ineffective case. And another thing is a case that cannot be performed in the exam in the duration of the OSCE station, which is usually 7 to 10 minutes. Or a scenario that is vague and leads to different interpretations among assessors. This is, again, a sign of an ineffective case. What to do to avoid this? One tip, please role play the case before taking it to the exam. Role play among your team, within your department, and ask your co-writers or colleagues to provide you with your feedback. Ask yourselves, does it accurately reflect the ILOs? Could it be misunderstood for anything else? Is the station a good reflection of the real practice? Does it have the validity of real actual cases that we encounter? What does the candidate need to be able to show in order to pass this station at his level? Year 4 candidate, or a master's degree candidate, or a PhD candidate. What does he need to do to show competency? Compare the opinion of your colleagues with your opinion, and please make sure after role-playing the case, in order to make it an effective case, that it's within the allowed time for the OSCE exam, make sure that You have provided all the adequate information that role players need to respond to the candidates. Please use the advice of your colleagues, and please, you might need to write the cases in pairs so you improve you can improve the validity and reliability of your cases. If you receive negative feedback, or the case is too ambitious, or the case is too long, please be willing to discard parts of the case. Modify the case. Don't be very defensive and act that this is the perfect case that cannot be, nothing can be summarized or discarded from this case. And make sure that when you train your role players, that they give the information relatively easily, because when you like put in your case template, please do not provide this information unless you are asked for. Sometimes we find a role player that is very conservative and sitting until the station ends without giving the information to the candidate in the proper time. So we need to work with them. Thank you very much. I think that this is the core presentation of our series, and hopefully it was beneficial. In the next presentation, we will cover how to write OSCE checklist or evaluation sheet, and maybe also assessor training, because these two topics are very relevant and correlated to each other.